Hi, I'm John Griffith. I'm an associate professor at Embry-Riddle Aeronautical University. Wanted to talk to you a little bit today about workplace violence and how that impacts people's mental health. It impacts it a great deal, whether you're talking about lost productivity or you're talking about time spent in dealing with grievances, people leaving an organization probably before they should because they're just frustrated, or sometimes even suicide. People just getting so distressed with their work environment, they decide to end it all. Now you think, well, what's this got to do with emergency services? Well, let's step back for a minute. I've got to tell you that there's an organization called the National Workplace Bullying Coalition. They actually have annual conferences. And what they try to do is they try to reduce workplace bullying. Do you believe that one? So that tells you how huge of a problem it really is and how many employees it really impacts nationwide. And you can think of all the money that's wasted on lost productivity, lawsuits, and the rest of it. So I looked into how that impacts firefighting and firefighters. And what I found was things haven't changed much. Started with a 1995 study that was published by the International Women in Firefighting. This survey had 551 respondents, and basically almost 90% were sexually harassed. 70% said it was still ongoing. 50% said it involved unwanted physical contact. 30% said it included inappropriate demands from a boss or a coworker. 13% of those said it happened more than once. 4% included demands for sex, and phrases such as "do this to keep your job" or "for promotion." And that happened 16 of 22 times that were reported. Of 339 reported issues, 34% were completely satisfied, but 57% said nothing was done, 41% said the problem was solved, and 15% said the violator was disciplined. So I looked at a 2008 report card study. It was put up by the Cornell's Institute for Women at Work. And it's entitled National Report Card on Women in Firefighting. This was a landmark study on women in firefighting. And it took a look at results from 675 firefighters working in 114 different departments in 48 different states. They conducted in-depth interviews with 175 female firefighters. Now, the folks at Cornell thought that the makeup of the fire service was probably never going to get to 50% men, 50% women, but they did look at like industries such as the military and construction and determined that the fire service should be about 17% women. However, as we probably all know, the current rate's about 4%. It's 4% with career firefighters who actually get a paycheck, and it's about 7% if you include all the 1.3 million firefighters we have in the US right now. So at the pace of growth, US fire service isn't going to hit 17% female firefighters until about 2080. So what's going on? What's wrong? And so they took a look and they asked similar questions to the ones that were reported in the International Women in Firefighting study. We looked at the Cornell study and couldn't believe the results because guess what? They didn't really change that much. So I worked on an Embry-Riddle study with a couple other colleagues that involved 141 survey takers. And this is what we found. On questions such as, have you been treated differently due to gender? Is there a formal procedure for gender or race-based complaints? Have you experienced ill-fitting uniforms or gear? Women reported differently than men do. And a great example of that is experienced ill-fitting uniforms or gear. 82% of the females who responded in the survey had taken ill-fitting uniforms or gear. 19% of men answered that question the same way. Why in the world would you send anybody into harm's way in bunker gear that doesn't fit, into a fire? that doesn't fit. Why would you do that? Women, 78% said they've been treated differently due to gender. Men only answered, 12% of men answered that question, that they agreed with that. The sad part is our survey done 20 years after the International Women in Firefighting Survey and about 7 years after the report card, National Report Card Survey. Guess what? People are answering the questions in similar ways. So in other words, what has changed since 1995? And the answer is not enough things. And so when you're dealing with situations where my supervisor doesn't address complaints concerning gender-related incidents, treated differently due to sexual orientation, promotions aren't decided upon fairly, gender is a barrier to my career development. And these were all answers that women answered at a statistically significant higher rate than men did in our survey, and stayed constant through the 3 surveys I'm talking about. You can see these things are remaining constant. So here's the takeaways. We need to identify best practices in supervisor and firefighter training that effectively address fair treatment for all firefighters. Firefighters should ensure, or fire chiefs should ensure all firefighters have properly fitting equipment. Fire chief organizations should become involved with equipment vendors to offer female-sized protective clothing. And the environment fire stations should be designed to ensure that female firefighters have appropriate showering, bathroom, and sleeping areas that afford privacy. And that last line ought to blow your mind, because a lot of old fire stations just aren't set up that way. And so they're almost set up, and the organization of the fire station itself creates problems. Lawsuits, lost productivity, people leaving the fire service maybe before they should, suicides. These are the reasons why we need to step up and fix this. And when you're dealing with mental health and changes in the workplace, this is one of the biggest issues you have to deal with in the future fire service. I'm John Griffith for Embry-Riddle Aeronautical University. Take care and stay safe.